just going to start. So, can you introduce yourself and say what your title is?
My name is Susan Gigla. I am a clinical nurse educator. I am the staff development coordinator for the Visiting Nurse Association Health Group, VNA, HG, here in New Jersey.
Can you just explain your job a little bit and tell me about what you do?
Sure. I educate the staff on clinical procedures, on policies. I train the staff, I train nurses, I train therapists, I train home health aides, social workers, nutritionists on how to provide patient care and, keeping them updated on the most current policies and procedures.
How has that changed so far from being in quarantine? Or with the recent coronavirus?
The changes with the recent coronavirus, the novel coronavirus, COVID-19, we have situational policies in place based on our intention to conserve supplies because it is a global crisis and supplies are critical at this time. And we are also training certain staff members to be our COVID-19 response team. So that will be the group of clinicians, primarily nurses, that are going out to provide care for patients that are diagnosed as being COVID-19 positive. So we're definitely putting that training in place.
Have you any run-ins with COVID-19 so far, like cases?
Yes, we have had positive COVID-19 patients that have come on service. Absolutely.
So how have you had to deal with that?
The staff that are going out to see these positive patients are dressing in full personal protective equipment that I'm sure you've heard a lot about in the news. So they're wearing special masks that are called N95s that will help with any airborne particles to prevent them from being exposed. They're wearing full gowns over their clothes. They're wearing protective goggles or face shields to protect their eyes. And they're providing care directly for those patients. And there is another group of our staff that are trained to provide the testing in homes for patients that are not able to leave their homes that have been identified as requiring testing to see whether or not they are positive.
Okay, that's very interesting. Are there any in Middletown, tested positive?
So I believe that the latest count from Monmouth County, I don't have the numbers in front of me, but yes, we have people in Monmouth County and certainly Middletown that have tested positive.
How have you adapted so far to quarantine? Not only your job, but just in general.
So for me personally, I'm an essential healthcare worker, so I am not staying at home. I am actually out in the field training in the offices, and I am training the staff who are out on the front lines. So because of that, I have not personally been home working from home. However, my family is, and I certainly am concerned for everybody that I care for and that I love and for our community. And it's really important I'd really like to answer that by saying I'd really like the message to be that it's very important for everybody to stay at home during this time. I know that it's frustrating. I know that it can become very monotonous and boring. However, we really need you to stay at home. You've heard the term flatten the curve, and we really need everybody to socially distance so that we're not spreading this virus, so that people don't continue to get sick from this virus and end up taxing the hospitals and end up coming onto our service for care and really extending this time that we have to be under quarantine. So I think that people are frustrated and they're like, I want to go out and I want to have fun because I'm frustrated for being in the house. And they're actually going to prolong the time that we're going to have to live like this by doing that. So that's something I really want people to understand.
So can you just elaborate a little bit more on the actions you and your family have taken to stay healthy and socially distance yourself?
Sure. So my family we're staying at home. My husband's working from home. My children are going to school virtually, which I'm very grateful for. We, if we have to go to the supermarket, we go and only shop for 2-week periods of time as to not keep going out into the community and, exposing ourselves to the general public. We're also washing our hands, and we're cleaning our doorknobs and our light switches and our remote controls with antibacterial wipes. And, we're certainly maintaining, those, that type of rule within the house.
Can you talk a little bit about your opinion on the virtual learning and your kids?
In this situation, I'm really happy that virtual learning is an option that was put into place. They're continuing with their education. This is certainly a crisis situation that we're dealing with. This is not optimal for anyone. Of course, my children would much rather be in school with their friends and enjoying the social aspects of their life, but we're all doing our part, and I'm really grateful that the school has the technology to allow for them to continue their education at home.
So can you talk a little about what the importance of a routine is, and have you created one?
I think that the importance of routine is essential in this situation. I think that we should all wake up, especially during the school week, wake up at a certain time, have breakfast, get on our computers, do our work, stop and have our lunch, continue with our work, and really try to maintain, get up, get dressed, that's important, and really try to maintain a schedule. Like I said, for me personally, I'm doing that because I am leaving the home to go to work. And so I am continuing to maintain that schedule.
How do you think this will affect everyone when we come out of quarantine?
That's a great question. I think that we are going to slowly come out of quarantine. We're going to continue to socially distance. We're going to limit the amount of people in areas until we slowly, get back to our regular routines. But it's going to take some time. I think that everybody, once we are allowed to start coming back and the businesses start opening up again, I think there's going to be a lot of excitement around that. I know that we're all looking forward to that day where we can regain some normalcy again in our routines. And that day will come. That day definitely will come.
And I know you said this a little bit, but can you just share some suggestions or words of wisdom?
It's really important to stay home, to wash your hands, to cover your cough, to cover your sneeze, to socially distance, to reach out to each other virtually. I know that we're so grateful for FaceTiming and being able to connect to other people, because it does also take an emotional toll to be in this situation. So it's important to connect to people, make phone calls, and connect with your family and the people that you are in staying at home with. I'm not going to say quarantining, because we're staying at home and we're doing the responsible thing and play games, watch TV, connect, and know that we're going to get through this, and we're going to get through this together, and we're going to have a lot of lessons that are learned. It's going to make us stronger and certainly a lot more appreciative for the life that we are going to continue to live.
Well said, thank you. Those are all my questions, so.
Thank you so much.